Well, hello everyone, and welcome to this webinar where we are going to provide information to potential applicants for the new System of Care RFA. I want to first of all thank everyone for their interest and say that my name is Gary Blau and I'm the Chief of the Child, Adolescent, and Family Branch here at SAMHSA that's responsible for this program. And as you can see on our first slide, SAMHSA is committed to ensuring that behavioral health is essential to health, that prevention works, treatment is effective, and people recover. So that's our particular focus on this. And what we're talking about today are cooperative agreements for the expansion and sustainability of the comprehensive community mental health services for children and their families program, a long title that essentially is our program that implements the system of care approach across the country. And this is the legislative name for the program that we use, and that our whole goal here is to ensure that the services delivered to children and youth that have serious mental health conditions and challenges are really that those services are provided within this type of a system of care framework that we'll be describing and that you'll hear more about, that you'll be writing your application. I'm going to go over a brief amount of program history and then some general information that I think will be helpful and important for you as part of your overall application process. To start with, I did want to remind folks that that SAMHSA has these 6 strategic initiatives. And it used to be 8, some people may remember, so starting this past year, we have narrowed it down and modified them slightly. Prevention of substance abuse and mental illness remains a #1 priority, along with trauma and justice, and certainly with the advent of Affordable Care Act and the expansion of the use of health reforms, certainly healthcare and health systems integration is important. The program that we're addressing now in terms of systems of care falls under a lot of these categories, most namely the Recovery Support Strategic Initiative, and also things like health systems integration, trauma, workforce, and health information technology as well. So it's important to have a context for when you're writing your application for where this fits, and you'll see in the RFA how this fits specifically within particularly the recovery support. The other thing that we're doing this year that may be somewhat different to folks that might have applied in the past or even had one of these grants in the past is that we're really focused on connecting this RFA and your application and the work to do to implement the system of care approach with SAMHSA's theory of change. This slide is really important because as you'll see in the application, there are some really important connections that we want you to demonstrate about where we're at within systems of care. You know, we've been operating now for a number of years, and we've really moved beyond a proof of concept or that this is an innovation or, in essence, a demonstration program through some of where we're going, where we're trying to better disseminate and implement this across the country with our full goal of really creating this wide-scale adoption of the system of care approach. The idea here is that whether you're a local community or a state-level type of an application, that we all have to work together to create more wide-scale adoption of the system of care approach. And so we're really interested, and you'll see that not only are we asking you to articulate how your application fits in with the SAMHSA theory of change towards wide-scale adoption, we are also asking our reviewers to see how this is going to really, I think, impact scores and other things, because whether you're at the local level or the state level, we have to work together to expand and sustain this approach. So that SAMHSA's theory of change, this slide, your connection to it is a little bit different than past applications and requests for those applications. So please pay attention to how this will be connected as far as your application is concerned. Now, many of you sort of know historically where we have been and why we're headed in that theory of change direction to wide-scale adoption. So just as a moment to digress, we really did begin in the mid-1980s with the CASP program, Child Adolescent Service System program, and from there built the idea and the legislative approach to systems of care in 1993 when it first started with really a small, modest investment of the federal government of about $4.9 million. And then since that time, over the years, our grant program itself to this year, where our budget is $117 million, and so that level of expansion across whatever administrations really, I think, demonstrates the importance of this approach. Now, since the inception of the program, we've had 252 grant awards. And as you can see, from the very beginning of the program all the way through about 2010, we had 173 awards for our traditional or historical way of doing the program. And then we started to change a little bit. We awarded one-year planning grants. And in 2011, you can see the 24 expansion planning grants, and then we coupled them with implementation grants. So we had two separate grants, an expansion planning and an expansion implementation grants, and we continue to do that for a number of years. This year, in FY 2015, we combined those efforts yet again to have one complete RFA, which is a 4-year RFA, and you'll see why we did that going forward, which is that we've said a lot of places have already been doing planning and that you can demonstrate those planning efforts within your application. And so we want you to start services sooner, within a 6-month period of time. And also, we're focused on that implementation, for over the 4 years, where the match dollars do change, but that it really is, I think, a reflection of us trying to help people meet their match, because in those first 4 years, the match requirement is, well, so for the first 3 years, it's 1 local to 3 federal dollars, and then 1-to-1 in that last year, so that it historically, the old program way of doing business, that changed in the 5th and 6th years, and people had a real hard time with it. So that's really our historical perspective, and we've been very fortunate that we've been continue to have the ability to provide these grant awards. As you can see, from the 173 grants all over the country, we had at least one in every state. And so those are the original Children's Mental Health Initiative Awards. That's what we call it for short. And then more recently, we've had the Expansion Planning and Implementation Awards, again, across the country in various places. And now we're continuing those efforts to work on expansion and sustainability. Consistent with our values and principles of systems of care, we remind people that we continue to try to transform the way that services are delivered for children, youth, and families with serious, mental health conditions. So the transformation equation is sort of our way of reminding people about what we're trying to do through this grant program. Transformation, in this case, equals V, or vision, which is providing the direction for the work that we do. And we add to that vision, and and you can see in the RFA, when you're asked to sort of explain your philosophy or how you're going to do things, that vision is important to this, and your partners being on board with that vision are critical. We add to that our belief system. And in systems of care, we have evolved our beliefs over the years, and now we talk about being family-driven, youth-guided, having cultural and linguistic competence, where we use evidence-based practices and focus on clinical excellence, and ultimately those beliefs, vision and beliefs, we add to that our actions, and these are your strategic approaches. What are you going to do in your application that is demonstrating all of these things? How are you demonstrating the involvement and the incorporation of family-driven care, or youth empowerment and cultural competence and evidence-based practices all together? And then we multiply that by continuous quality improvement, which is the feedback that we get, which is why, essentially, that we've evolved and done more. So, for example, 20 years ago, we talked about family involvement, but now we talk about family-driven care, and that comes from the feedback that we've received. I think it's also important, as you are looking and applying for the grant, that you have a context for the service delivery. most of what we try to accomplish in systems of care really is focused on this idea of wrapping services around a child and family. And so we want to make sure that the resources and in other revenue streams that you can bring to bear as part of the application is something that you really focus on. You'll see in the requirements in the application about looking for the third party or the Medicaid revenue and really combining all those efforts across child serving systems. And to help you with that, we wanted to remind folks that in May of 2013, SAMHSA and CMS, the Centers for Medicare and Medicaid Services, put out an informational bulletin related to the coverage of behavioral health services for children, youth, and young adults who have significant mental health conditions. And on your screen, you can see the where you can go for the file that explains this, because CMS joined with SAMHSA to say that services that are provided that are reflective of a system of care approach, such as intensive care coordination, wraparound, peer support services like parent-youth support, intensive in-home, respite, mobile crisis stabilization, flexible funds, and then other home and community services can be paid for by Medicaid. Now, obviously, there are challenges potentially to get those services paid for, potential waivers that need to be applied, but the goal of this informational bulletin really is to help people implement and then sustain the system of care services that we have found to be particularly beneficial for people and implementing this approach. So and the outcomes of that really improve. And I think what we know from our national evaluation data really is that when these kinds of services are provided and over a period of time, that the outcomes, that young people's functioning improves, whether it's behavioral or emotional, whether it's keeping them out of hospitals, inpatient facilities, or detention centers, or connecting the dots between juvenile justice and child welfare, that our youth and families have better outcomes based on a system of care approach using these services. Another one has to do with the final rule on home and community-based services that amends the Medicaid regulations. So we also have the opportunity to look at various approaches to the expansion and sustainability of the system of care framework. So that is critical. How will your application connect these dots to expand, to push on the theory of change, and then to look at sustainability of the services in the systems? We also, as you'll see in the application, are really focused on our attempts at ensuring that whatever grants we award do the best they can at improving linkages and connections across service delivery systems for young people, whether that's a connection between mental health, substance use, certainly Medicaid and other third-party insurers, child welfare, juvenile justice, primary care, education, early childhood, you name it. We're really focused on this, as you can see, in terms of you can choose populations of focus, how it's all going to connect together between, say, community residential providers. So all of those partnerships are really important as far as developing an application that is comprehensive. So we're really encouraging you over the next couple of months, or while you're figuring out the final touches on your application, to get those partners on board, to demonstrate that you're finding ways to finance, to expand the workforce, to focus on evidence-based practices for the particular population or culture and language that is being addressed. So all of those linkages and connections are part of this. And then I wanted to really sort of focus you on what I did when I used to write these kinds of applications, which is, of course, to look at what you get scored for. And if you take a look at how the scoring works, you really can see the connections between what we're asking you in required services with ultimately how reviewers will score your application. And it has to do with your justification of where you're coming at with respect to the geographic area, with respect to if you're a local community. We have identified that you can receive up to $1 million a year for the 4 years. And then how are you connecting to the broader, state level or territory or tribal level, kinds of things that you're really meeting in order to establish that sustainability framework. Or if you're a state level, we've actually identified additional dollars, so you can get up to $3 million, because we recognize that a state like California or Texas, or some of the larger geographic areas, certainly different as far as trying to address some of the financial needs than smaller localities. So what we've tried to do is to incentivize states and really large geographic regions to have additional dollars to do this work, and to focus on using some of those dollars to create a couple of specialized, whether they're pilots or communities that actually implement the system of care, and then vice versa, have the ability for the local level to do the work that is necessary to create a system of care approach in the local community, and then use some of those dollars to engage the state and other policymakers in how do we expand this. As we see this working, how do we move into other counties or other areas of our state, and how do we get support for doing that? Again, that connection to SAMHSA's theory of change around wide-scale adoption. So please provide a clear rationale for your budgets, for how the articulated vision will be with respect to the SAMHSA theory of change. Document prior, efforts and the evidence, in essence, that strategic planning has occurred or that is going to continue and to expand, and that systems of care and the implementation of this, and that children's mental health is a priority. I think that's really helpful for reviewers to see. I talked about the connection to SAMHSA's theory of change, the collaboration with other child-serving entities, really the financing approach to this. How will the transition occur, after that 4th year, where there can be demonstrated sustainability, and then certainly our hope is that it begins to expand. And then what are the strategies or the collaborative approaches and the connections to other federal activities, be they other federal grants, my colleagues, for example, that do the work in healthy transitions or safe schools or Project Aware, or our block grants, or other federal activities across child welfare or juvenile justice, or our substance abuse grants, et cetera. All of those things really do comprise the system, and so it's wonderfully helpful. And as you'll see, there are whether points or overall vision for this. That's what our reviewers are going to be looking for. And then finally, it is really critical that we follow the values and principles that have really, I think, set systems of care apart for all of these years about how we do this approach, which has to do with how are families and youth involved, family organizations, how are they connected to this in terms of the application, in terms of the implementation. Those are really critical things. How do families and youth participate in the decision making, the development of budgets, the treatment activities, and then individually around treatment plans and driving their own care. It's really critical, because our data has really been clear that the more youth and families are involved, the better the outcomes. And so when we see that, we want to push the envelope on doing more of that. So all of these things are critical as part of your required activities, and for you to demonstrate that you have your requisite players on board, and that your vision and your whole application really is moving you forward to that expansion and sustainability. And then finally, we do ask and expect that everyone files and does this through grants.gov. We are moving in that, to having full reviews and everything else through online. And so please do that. Please look at that. It always pains me when I hear about somebody that did not, practice or try to get the application uploaded a couple of days in advance, and then hits some kind of snag about stuff, and lo and behold, it's 11:59, and you're trying to get it done, and the clock switches over to the next day, and we have no control over that. Once the application date ends, then we turn everything over to our grants review office, and they have legal and other rules that have to be followed. So I just encourage people to do your diligence beforehand, so that you're not stuck at the last minute after working that hard on an application only to be kicked out because you missed a deadline or didn't follow the right rules. around the page numbers or the font or things of that nature, which are so critical. And while I recognize, that the challenges in that, it has to be fair for everyone. So that's why we really do encourage everybody to do that. So we are really excited this year because I think that we've taken the best of all worlds that we've learned about. We've taken the lessons learned as continue to evolve the system of care grant activities. We continue to push on, I think, the values and principles that are necessary. And I think that this particular application is the best of all of that, and also to help states and communities work together in a way that I think we've not required in the past, but that we really are pushing on now for the sole purpose of moving us along SAMHSA's theory of change to wide-scale adoption of the system of care framework. So with that said, I want to say to folks that if you have questions or comments, please email the people listed, whether they're grant-specific questions or programmatic questions. We're here to try to help you submit a very successful application. I think that we have a number of applications that we can award this year, so we're hoping to see as many applications as possible because we'd love to continue our efforts at expanding this approach all over the country. And I wish all of you lots of good luck in preparing and submitting your application. Thank you very much.